used to really focus on rest and this idea of RICE, rest, ice, compression, elevation. And we've now realized that there's an important component of recovery that involves rehabilitation and movement. And so that rest, it has a place, but it's more of a few days of rest and then starting to get back to activity, getting back to movement. Some of that depends on the injury, but for example, if you're thinking about like an ankle sprain, we used to say that you should be on crutches for a week, and now we have more of the, after 2 or 3 days of resting, to start moving your ankle around, to start bearing some weight, and that you're really going to need to use pain as a guide. And so it may hurt a little bit, it shouldn't hurt a lot, but that you need to start pushing, and that this is really what I'm talking about in terms of exercise and getting back to activity really pertains to muscles and ligaments. And so this would be very different if you had a fracture, if you had just had surgery. But for most minor injuries, they're usually muscles and ligaments that are involved. Well, the first thing I would say is really use the resources that you have, so that, every kid should have a primary care provider, and that using them as a resource of, what do I need to do? Are there other people that I need to see? If your kid is not getting better and you're really worried, there are other providers who are available. So there are sports medicine providers, and they really specialize in helping kids get back to sport or helping kids who've had a sporting injury. There's also rehabilitation medicine providers, and they really focus on function. And if your child is having issues with getting back to normal function in some regard, whether it's walking or using their hands, they focus more on those kinds of things. And there's physical therapists who really support both sports medicine providers and rehab medicine providers in really what are the specific exercises, what are the muscles that we need to work on to get them back to their normal activities. Human body is infinitely complex, so there is so much that we don't know. And as I talked about with RICE, that we really used to think of rest as this cornerstone. I think another thing that I didn't talk about is back pain, and that if you strain back muscles, that resting can actually be problematic, that you really need, usually when someone strains their back muscles, it's because there was some weakness within that musculature, and that you need to actually work on getting those muscles stronger. And so that's something that we've learned over time, and that I am hopeful that as we get more and more experience within the sort of rehabilitation approach, we understand better how to get your child back more quickly, like what are the specific exercises that are really going to help for that specific injury that they had. American Medical Society of Sports Medicine has a search database where you can find a sports medicine provider who might be close to you, to your community. There also are certainly a lot of recommendations about physical activity that can kind of give you some ideas of what are some different ways that I can get my kid to start moving again. When we're talking about starting to move after an injury, it's really starting with initially just what we call range of motion, or really moving that joint in the ways that it moves, and then starting things like walking or really low impact activity that shouldn't require a lot of resources.